Let me make the point that already we have over 1,000 general practices that have been delivering vaccines. An extraordinary achievement was that despite the floods, despite the inclement weather last week, every practice that was due to receive the vaccines did receive the vaccines. We've already had distributions for this week rolled out and continuing, and indeed distributions for next week have started today. So that process is underway as we expand from 1,000 to 2 to 3 to 4,000 practices by the end of April, and I think that's a very positive sign. I'd like to address events in Queensland, if I may. As people may be aware, Queensland now has 7 cases in the current cluster. 4 additional have been identified, one of which is likely to prove to be historic and is potentially the link between the initial outbreak some weeks ago and the current outbreak. I have spoken with the Queensland Minister this morning, Yvette D'Arth, and offered our support, and the actions we are taking are as follows. Firstly, we have authorised asymptomatic testing, which means that people can be tested without symptoms across the Brisbane region. That's already underway through the GP respiratory clinics or the Commonwealth respiratory and vaccination clinics. Secondly, we have authorised, and I have authorised, asymptomatic testing in aged care facilities in the affected areas of Brisbane. And I have also instructed that the Commonwealth and Queensland Aged Care Response Centre be established. At this stage there are no signs of any infections that have been transmitted to aged care, but we're taking early pre-emptive action to ensure that those protections are in place. As we speak, the Chief Medical Officer, who briefed me earlier today, is conducting leading the AHPPC, or Australian Health Protection Principal Committee, with Chief Medical Officers and Chief Health Officers from all states and territories. And importantly though, the message that Queensland has given is one that I would re-emphasise as well. Vaccinations are considered a critical reason to leave home. We would encourage all patients, subject to checking with their doctors, to continue with their vaccination program. So if you are in the Brisbane area, please continue with your vaccination program, subject to your practice being in a position to do so. And we understand that that is the case, and if there were any interruptions, we'd provide that advice. At this stage, as we speak, I haven't received any information.